So the first thing we're going to do for the elbow eval is to clear C-spine. So can you look up for me? Look to your right, look to your left. Can you take your right ear to your right shoulder, left ear to your left shoulder, and then can you look down for me? Perfect. And then can you bring your arms over your head? This would be clearing active shoulder abduction. Can you flex and extend your elbows for me? So that'd be active elbow flexion and extension. Can you flick your wrist for me? So that'd be active wrist extension and flexion, and then can you turn your hands over? And that's active supination and pronation. So the next thing I would do was take him through passive range of motion for elbow flexion and extension. So can you face me for him? Thank you. So I'm going to come over here to his side. I'm going to hold distally or at his distal radius and ulna and take him to flexion over pressure and then extension over pressure. And then for his wrist, I'm going to hold here at his forearm, apply over pressure on wrist extent. Don't hold, just let me take you through, thank you. That is wrist extension and then over pressure for wrist flexion. And then for supination and pronation, so I over apply pressure on pronation and then over apply on supination. So next up would be our isometric resistance testing. So first thing, I'm going to test elbow flexion and extension. So I'm going to come by your side. You have your arm out for me, palm up. So this is going to be this is resisting elbow extension, so hold on and move you. Good. And then I'm going to resist up, hold on and move you. That's resisting elbow, sorry, this was elbow flexion, this is elbow extension. Can you, perfect, do this. And then hold on and move you. So that's wrist flexion, and then hold on and move you. That's wrist extension. And then we're going to do pronation, supination. Can you twist your thumb in for me? I'm going to push out, you push in with your wrist. Perfect, that is resisting pronation. And then turn your hand out, I'm going to turn the other way. So perfect, and that's resisting supination. So the first tissue we'd be testing is the distal biceps tendon. So the first thing we do for that is isometric resistance of elbow flexion. So you put your arm at 90 for me. I'm going to say hold on, let me move you. Perfect. The next thing would be a hook test, which would be trying to latch the distal biceps tendon right there. So I'd grab it, and it's also palpating it as well. And if it was a positive, it wouldn't be there because we wouldn't be able to hook it. So the next thing we test is for medial epicondylitis. So the first thing we do is isometric wrist flexion. So I'm going to stabilize the patient's hand. I'm going to say hold on, let me move you, and try to flex your wrist. Perfect. The next thing would be manually muscle test the flexor carpi ulnaris. So we're going to have him flex his wrist, ulnarly deviate, so that way. And then I'm going to say hold on, let me move you. Perfect. And then the flexor carpi radialis, which would flex and then radially deviate. I'm going to push and down towards radial deviation. Hold on, let me move you. And perfect. And then I'm going to palpate the medial epicondyle, which is right here. If there's any pain, it'd be reproduced there. So next up is the lateral epicondylitis. So first we do isometric wrist extension. So we're going to take his hand, I'm going to push my hand here, push up, hold on, let me move you. Perfect. The next thing we do is test the extensor carpi ulnaris. So we're going to put his hand in slight flexion and ulnarly deviate it. I'm going to push down and away. Hold on, let me move you. Perfect. The next one is the extensor carpi radialis brevis. So I'm going to extend his hand, slight radial deviation, but I'm not going to extend the elbow. And then I'm going to push down and away, so hold on, let me move you. Perfect. And then I'm going to do the extensor carpi radialis longus, which needs elbow extension to put the muscle full on stretch. So and then extend and radially deviate for me. I'm going to push down and away. Perfect, thank you. And then we have and then you can bend at the elbow again. And then we have the extensor digitorum tendons we're testing. So can you open up your hand like that? I'm going to push down and hold down and resist with your whole hand. Or don't let me move you. And perfect. And then we would palpate the lateral epicondyle, which is right here. So the next tissue to be tested is the ulnar collateral ligament. So the first thing we do for that is just a normal stress test. We place the elbow in 25 to 30 degrees of flexion because this is the elbow's open pack position. We then grip over the medial and lateral on the medial and lateral epicondyles, and then apply valgus stress by abducting the humerus, the forearm. And then next up we would do a moving stress test. So this would be done by having the patient bring his arm up 90-90, stabilizing at the medial and lateral epicondyles, taking the arm, applying a valgus stress, and taking the arm through elbow flexion and extension. But you really want to stabilize at the condyles to resist external rotation of the human wrist. So the next test to be done on the UCL would be the pivot shift test. I don't have a plinth, so I'm going to do this on the floor. We're going to take the patient's arm. We're going to apply oversupination at the wrist. My other arm is going to be here. We're then going to apply a valgus stress with an axial load on the elbow and then take it through extension. So the next structure we would test would be the radial collateral ligament, and that is done through the varus stress test. So I'd come here, and then I would apply a varus load, so it'd be adducting the forearm, and then palpating it would be right there. And last but not least, we would test their nerves. So the first thing we would do is just the Tinel sign by tapping the cubital tunnel, where the ulnar nerve travels. So it'd be right here on the medial side of the elbow, and we just tap it, and we're looking for a reproduction of symptoms. And then we have the stolen paper test, which tests the ulnar nerve as well. So can you open your hand? I'm going to put this in between your fingers. Can you close it on the, yep, perfect. And then just hold it there and don't let me steal it. And we're expecting some resistance, so it's perfect.